GLP-1 receptor agonists have emerged as one of the most talked about medical tools in recent years, particularly for their ability to support weight loss and improve blood glucose regulation. But they are far more complex than simply a weight loss drug, and understanding their full physiological impact is essential for anyone considering their use, as these medications work by mimicking a hormone naturally produced by the body called glucagon like peptide 1, or GLP-1, which is secreted by cells in the intestine as well as neurons in the brainstem. And this hormone plays a crucial role in regulating appetite, slowing gastric emptying, and stimulating insulin while suppressing glucagon, which together help to maintain balanced blood sugar levels. But the medications themselves have been engineered to last far longer than the naturally occurring hormone, with drugs like semaglutide, branded as Ozempic and Wegovy, having a half-life of about 1 week compared to the mere 1 to 2 minutes of natural GLP-1, which allows for sustained appetite suppression, prolonged gastric slowing, and enhanced glucose control, all of which contribute to meaningful weight loss in many patients. But this impressive effectiveness comes with important considerations, including potential side effects such as nausea, vomiting, diarrhea, constipation, bloating, fatigue, and in rare cases, more serious complications like pancreatitis or gallbladder issues, which are often related to the body's adaptation to prolonged hormonal signaling and the changes in metabolism that occur as a result of significant weight loss. And it is also critical to recognize that not all weight lost on these medications is fat. Some of it can come from muscle, especially in older adults, or those not incorporating resistance training and adequate protein intake, which can lead to decreased strength and functional capacity, highlighting the importance of pairing these drugs with proper nutrition and exercise to preserve lean tissue while achieving fat loss. And beyond the physical effects, there is a financial and practical cost to consider, as these medications are often expensive, with monthly prices exceeding $1,000 without insurance. And while some patients may turn to compounding pharmacies to access equivalent doses at lower cost, caution is required to ensure the safety and quality of these sources, making it clear that long-term adherence is not only a matter of medical suitability, but also financial feasibility. And even when the medication is used properly, there is the reality that much of the weight lost may return once the medication is discontinued unless lifestyle habits have been substantially changed, meaning that diet, exercise, and consistent behavioral modification remain the cornerstone of sustainable health outcomes, which is why GLP-1 receptor agonists should be viewed as a tool to support, not replace, these foundational practices, and they are most appropriate for individuals who have struggled to achieve meaningful weight loss through lifestyle changes alone, or for those with type 2 diabetes or obesity-related health risks, where the benefits of improved glucose control and reduced cardiovascular risk outweigh the potential side effects and cost. And while clinical studies have shown additional benefits, such as reduced risk of cardiovascular events in people with pre-existing conditions, the exact mechanisms are still under investigation, possibly related to lower blood glucose levels, reduced inflammation, or the metabolic effects of fat loss, making it essential that patients and healthcare providers weigh these potential advantages against individual risks, preferences, and long-term goals. And this individualized approach is crucial because health outcomes are not solely determined by medications. They are shaped by a combination of genetics, environment, behavior, and sustained lifestyle practices, which is why patients should be educated and empowered to make informed choices about their care, understanding that medications can enhance results but do not substitute for healthy habits, and in practice, using a GLP-1 receptor agonist as intended usually involves gradual dose titration to reduce gastrointestinal side effects, concurrent attention to diet quality, prioritization of protein intake, and engagement in resistance training to mitigate muscle loss, all of which contribute to better adherence, more effective weight management, and improved overall health outcomes, while also acknowledging that not every patient will respond the same way. Side effects can persist for some individuals, and the decision to start therapy should involve a frank discussion about the potential need for indefinite use, cost considerations, and realistic expectations regarding weight maintenance, as well as the understanding that some individuals seeking only minor weight loss may find the risks, financial burden, or long-term commitment